Cardiac catheterization. Although the technique and accuracy of non-invasive testing continue to improve, cardiac catheterization remains the standard. For the evaluation of hemodynamics, cardiac catheterization helps provide not only intracardiac pressure measurements, but also measurements of oxygen saturation and cardiac output. Hemodynamic measurements usually are coupled with left ventriculography for the evaluation of left ventricular function and coronary angiography. Coronary angiography remains the criterion standard for diagnosing coronary artery disease (CAD) and is the primary method used to help delineate coronary anatomy. In addition to defining the site, severity, and morphology of lesions, coronary angiography helps provide a qualitative assessment of coronary blood flow and helps identify collateral vessels. Correlation of the findings from coronary angiography with those from left ventriculography permits identification of potentially viable areas of the myocardium that may benefit from a revascularization procedure. Left ventricular function can be further evaluated during stress by using atrial pacing, dynamic exercise, or pharmacologic agents. Indications for cardiac catheterization. Cardiac catheterization is undertaken for the diagnosis of a variety of cardiac diseases. As with any invasive procedure that is associated with important complications, the decision to recommend cardiac catheterization must be based on a careful evaluation of the risks and benefits to the patient. Indications for cardiac catheterization are as follows: identification of the extent and severity of CAD, and evaluation of left ventricular function, assessment of the severity of valvular or myocardial disorders (AG), aortic stenosis or insufficiency, mitral stenosis or insufficiency, and various cardiomyopathies to determine the need for surgical correction, collection of data to confirm and complement non-invasive studies, determination of the presence of CAD in patients with confusing clinical presentations or chest pain of uncertain origin. Contraindications for cardiac catheterization. With the exception of patient refusal, there are no absolute contraindications for cardiac catheterization. Clearly, the risk-to-benefit ratio must be considered. Any procedure that is associated with some degree of risk should be contraindicated if the information derived from it will be of no benefit to the patient. Relative contraindications are as follows: severe uncontrolled hypertension, ventricular arrhythmias, acute stroke, severe anemia, active gastrointestinal bleeding, allergy to radiographic contrast, acute renal failure, uncompensated congestive failure so that the patient cannot lie flat, unexplained febrile illness or untreated active infection, electrolyte abnormalities (EG), hypokalemia, severe coagulopathy. Note that many of these factors can be corrected before the procedure, which lowers the risk. Pre-procedural risk factor correction always should be considered unless the procedure is being performed in an emergency